Hello everyone, welcome to GrowMed. If you are new to GrowMed, subscribe to GrowMed and tap the bell icon to get regular study tips. In this video, we will look at some topics which are must to do from the community medicine or the PSM. Before starting the reading of the PSM, you need to have a list of the important topics, the must to do topics, which will help you in making your studies more easier because you will be coming to know which topic is of high importance and from which topic the questions have been asked. So this is the list of the important topics, and also it will help those students who have not studied PSM even once and are worried about the PSM, how to read and what all to read. You guys no need to worry because you can complete these topics and revise these topics to get a decent score from the PSM. So let's start the video. So questions are asked from the epidemiology and mostly the cohort studies and the case control. So questions are asked on the parameters which are calculated in the cohort study, like the relative risk, then the attributable risk per attributable risk. So questions are asked on its formula, so you need to look at the formula also. And questions are also asked that what can be calculated by using the cohort studies. So it is the strength of association, and also we can calculate incidence by using these cohort studies. So the relative risk, it says about the incidence of the exposed and the non-exposed, and likewise these also says about the incidence. Then moving on to the case and the control. So in these two groups will be involved, the case and the control, and studies are done between these two groups, and these are calculated using the odds ratio. So the formula for the odds ratio is equal to the A and D divided by C and B, the parameters which we will be calculating. Okay. Then other two types of the analytical studies from the epidemiology are the cross-sectional study and the ecological study. So questions are not asked much on this. So from the cross-sectional studies, you need to just remember that it says about the prevalence. So one liner can be asked that relative risk says about what. So it will be the incidence of exposed by non-exposed, and likewise cross-sectional says about the prevalence. Then moving on to the demographic stages and the demographic cycle. So this cycle will be consisting of the five stages, the 1, 2, 3, 4 and the 5. So you need to remember which stage stands for what. Like this one is the high stationary phase, and in this the birth rate as well as the death rate is high. Okay. Likewise the second is the early expanding, low stationary, and then the declining. So this one is seen in the European countries, and the third one seen in the India. So you need to remember this India and the European countries. Okay. Then the stages means it will be involving the five processes which are like the fertility, then the marriage, migration, social mobility and the mortality. So you need to look at all the points regarding the demography and the cycle and the stages. Then moving on to the vitamin deficiency, a very important topic because vitamin deficiency के बिना question बन ही नहीं सकता FMG का. Okay, so 3 to 4 questions every year are asked from the vitamin deficiency, either in integration with the biochemistry, ophthalmology, or PSM, then मेडिसिन, सर्जरी, साइकेट्री, एवरी सब्जेक्ट, सब सब्जेक्ट में आता है वाइटामिन डेफिशिएंसी. ठीक है, सो इट इज़ अ मस्ट. यू नीड टू look at all the points. So I have already uploaded a video on the vitamins जिसमें मैंने बस vitamins के बारे में डिस्कस किया हुआ है, and along with that the points which you must remember, the deficiency, the required doses, then how will you treat it, the clinical features, सब कुछ. So do watch that video of the vitamins. Okay. Then moving on to the waste management. So using the bags, right? Yellow bag, then red bag, then white bags. Okay. So questions are asked ki which waste is put in which kind of bag. So let me just give an overview of this. So yellow bag means yellow mein there will be anatomical waste, animal waste and medicine which are expired medicine. Okay. And we will be treating it by the incineration. ठीक है. Then red, we will be disposing the plastic things in it. Then white, sharp things, and then there's another category blue. Blue में हम ग्लास और मेटल इम्प्लांट्स को डिस्पोज करेंगे. ओके, सो क्वेश्चंस आर कैन बी आस्क्ड गिविंग एन इमेज ऑफ द येलो बैग एंड दे कैन आस्क विच ऑफ द फॉलोइंग इज डिस्कार्डेड इन दिस बैग, और दे कैन गिव समथिंग लाइक एनाटॉमिकल वेस्ट, जैसे कि प्लेसेंटा हो गया, प्लेसेंटा हम किस में डिस्पोज करेंगे, समथिंग लाइक दैट. ओके, तो यू नीड टू लुक एट दिस थिंग्स, क्योंकि हर साल एक ना एक क्वेश्चन तो आया ही है वेस्ट मैनेजमेंट पे, तो एक्सपेक्टिंग अ क्वेश्चन इन द फ्यूचर ऑल्सो फ्रॉम द वेस्ट मैनेजमेंट. So moving on, triage. Triage is also an important thing and questions are asked on the triage also. One question ये आप लिख के रख लेना, क्योंकि in the past year all the papers there were questions asked on this waste management and the triage. ठीक है. So triage also we will divide these things, these groups. जहाँ पर भी कोई डिज़ास्टर हुआ है ना, वेर एवर देर इज़ सम डिज़ास्टर हैपनिंग और समथिंग लाइक वॉर और एनी थिंग, वी विल बी डिवाइडिंग द patients, the group of the people, into the green, then the black, red, the yellow. So red means they are under high priority, then green means these patients are okay, are ambulatory and these can be treated in the last. Black means these patients have low chances of surviving, so these are not given much importance. And the yellow ones, they are the moderate patient like mild fracture or cuts. Okay, so क्वेश्चन का पैटर्न कुछ भी हो सकता है. द पैटर्न कैन बी एनीथिंग लाइक दे कैन ask red color belongs to which, or green color belongs to which, or they can give that a patient he has a fracture and which category he will fall into, so he will fall into the yellow category. Okay, then moving on to the healthcare systems. So questions are asked on the healthcare system like the PCH, the CHC, then the sub center. तो इसकी फैसिलिटीज़ पे क्वेश्चन पूछे गए हैं लाइक व्हाट फैसिलिटीज़ आर प्रोवाइडेड अंडर द PCH, CHC, दैट इज़ द कॉलेज, मेडिसिन कॉलेज, डिस्ट्रिक्ट लेवल, एंड देन द सब. एंड क्वेश्चंस आर ऑल्सो आस्क्ड ऑन द वर्कर्स, कौन से वर्कर किस लेवल पे काम करते हैं, जैसे कि आशा वर्कर है, ठीक है, देन मल्टीपर्पज़ वर्कर मेल एंड फीमेल, देन द आंगनवाड़ी वर्कर. सो क्वेश्चंस आर आस्क्ड ऑन दिस कि what is the requirement for a person to be ASHA worker, then multi-purpose male worker, so female worker, what are the requirements? Like for ASHA it is the 10th pass and it is better if the female is a widow. Okay, and for the Anganwadi it is I think 5th pass, and for male purpose multi-purpose male and female it is the 10th or the 12th pass. Okay, and also questions are asked on the functions, what things or what functions these people perform in the society. Like for example, the Asha, she helps in providing the nutrition to the female. She takes the female to the pregnant female to the hospital, but she does not conduct the delivery. Okay, and the Anganwadi worker works in the Anganwadi, looks at the nutrition of the children. And multi-purpose worker male, he usually does the things like collection of the stool. Okay, then he does active malaria surveillance. Okay, all these things, these are done by the multi-purpose worker. So you need to look at all these points from the healthcare system. Then moving on to the Anemia Mukt Bharat. So this is also a repeat topic and frequently questions are asked from this. So the questions are asked like there's a whole table, right, which you must by heart. So that table consists of the age, then the folic acid, and the iron requirements, and how much time we will give it. So the duration, like for example, for the pregnant female it will be the 4 microgram of the 4 mg folic acid and iron 50 mg, and we will be giving it daily. Likewise for the adolescent it will be bi-weekly, and I am not able to remember the dose here actually, the exact dose. I think it will be the 50 mg and the 500 microgram, something like that. Okay, so do look at the table of this Anemia Mukt Bharat. Then moving on to the school health program, this is also an important topic because questions are asked like what all tests are done under the school health program, who is the in charge of this, and by whom it will be done. The in charge is the medical officer. Okay, and the screening tests will be done mostly by the teacher. Okay, so the teacher will be coming to the hospital if she finds any defect or any disease in the child. And questions are asked ki what should be the size, then where should be the window, towards the left or the right, and then the bench desk, which type of desk it should be. It should be the minus type of desk. Okay, so all these questions, these are covered in the school health program. Then moving on, contraception. This is also a very important topic, and you can expect one question from it. So questions are asked on the emergency contraception as well. So clinical cases can be asked that a female, she comes within so and so hours, like within 72 hours, then how will she wants contraception, so which will you advise to her? So 72 hours we will be advising the IUD, right? If it is then 12 hours, then we can advise progesterone, like that. So you need to look at the duration and also what is described in the question. So questions on the contraception are asked on the antara, which is the injection, then chaya pills, the doses of this, then the rings, then the sponges, everything. Okay, so contraception, to look at all the points along with the images, because image based question can be asked. They can give an image of the antara and ask what is the content of the antara, or they can also ask that antara is which kind of contraception, so it is an injectable contraception. Then moving on, so the levels of prevention, this is also an important topic, and this prevention is classified into the primary, secondary, and the tertiary. Okay, so which things come under the primary? Let's discuss them. So it is before the occurrence of the risk factor, like for example source reduction, which we will do it for the malaria, to remove the water, stagnant water, so that there cannot be breeding of the mosquito. Okay, so this will come under the primordial. Likewise, if it is primary, then it will be the thing that risk factors are present but the disease has not occurred yet. So before that, if we take preventions, then it will be primary level, and it will, some examples are the vaccine, then the OCPs, mosquito nets. Okay, then likewise there is secondary and the tertiary. So any kind of example can be given. So you need to understand first what is the primary, secondary, and tertiary. Just remember this thing, that risk factors, reduction of the risk factor before the risk factor occur. If we take prevention, then it will be primordial. If there is risk factor present and disease has not yet started, then it will be primary. Secondary means the disease has started but it is still not progressed. Okay, so in the early stage we detect it and we start the treatment, then it will be the secondary. And the tertiary means that the disease has started and it is progressing, so we will do the rehabilitation methods. If you remember these basic four things, then any example will be given, you can easily be able to solve the level of prevention. Then moving on, so questions are asked on the sampling. So it can be of two types, the random, then the stratified. So types are the simple random, then the stratified random. Okay, then the systemic random and cluster random. So this usually image based question can be asked, and also definition can be asked. Like, moving on, these are the health indicators, the human development index, poor quality life index, and the daily disability adjusted life years. So questions are asked on its formula, and also its components, like what component does the HDI have, then PQLI have. Okay, then also one liners are asked that which is the best indicator of the development of the society, which is the best indicator of the disease burden in the society. So all these things you need to look from this topic. Then moving on, so these are certain rates: infant mortality, maternal mortality, crude birth rate, crude death rate, and there are other various rates like the neonatal mortality rate, then the reproduction rate, net reproduction rate, then general fertility rate, total fertility rate. So questions are asked on the formula of this. So you need to by heart this formula, that what comes in the denominator and what comes in the numerator, and how will we calculate these things. Okay, then moving on, vaccines. This is also very important topic. Questions are asked on the types, storage, and the national immunization schedule. So all vaccines come under this schedule, and at what age we will be giving, and the dose. So all these things you need to look from the national immunization schedule. Then vaccine types, the live, the killed, then which are recombinant, and the storage, how do we store these vaccines. And also questions are asked on the route of the vaccine, how will you give the vaccine. Like for example, the influenza virus, live influenza, we give it by the nasal. Then the oral polio virus, we will give it by the oral route. Okay, so these were some example of the route. And also questions are asked on the side effects or the adverse effects related to the vaccine. So there are few vaccines after taking which adverse effect will be developed. Like for example, by after taking the rotavirus, the patient can develop intussusception. Then the OPV virus, a patient can develop the paralysis. Okay, so you need to look at those things also, which vaccine causes which side effect. Then moving on to the disaster management. The steps which we need to follow during the disaster management is first the prevention, which is known as the mitigation. Then after that, the then if at all the disaster happens, then migration from that place, then after that rehabilitation. Okay, so these are the steps which you will be following. So you need to look at all those things. Like national health policies, there are various health policies for the TB, then the leprosy, then for the malaria, dengue, chikungunya, then also for the blindness. So you need to look at these health national policies and what all benefits are provided under these policies. Then moving on to the open vial policy. Already I have uploaded a video on this national health policies. So images also have been discussed, and along with that the previous year questions. So do watch that videos from the national health policies. Open vial policy. So this policy is used for certain drugs like certain vaccines, the DPT, the hepatitis, the PCV, hepatitis B, the PCV, OPV. Okay, so these certain vaccines, they follow this open vial policy. That means that once a vial is opened, it can be kept for some duration of time, like 4 weeks, up to 4 weeks, and then it can be used again. Okay, so questions can be asked, which of the following vaccines follow this open vial policy. Vaccine vial monitor, most of you might already be knowing it, so it is a very easy topic. So in the vaccine vial there is a mark like a circle and a square, so you need to look at the circle and the square and their color. If it changes and becomes dark, then you cannot use it, and if it is light, then you can use it. Okay, so image based question can also be asked from this vaccine vial monitor. Then moving on to the family, so questions are asked on the phases and the types, like the nuclear family, then the complete family, then the extended family, like that. Okay, so definitions are asked, and phases means there are a couple of phases, like whenever there is a wedding between the two people, so whenever they are married, that will be like formation. That stage is called as the formation. Then after the birth of the first child, they will be entering into the phase of the extension. Then after the birth of the last child, it will be the complete extension. Okay. So this is the sequence of the phase, and question can be asked that couple, they are having their first child, they have given birth to their first child, and what will be the family phase they are going into, so it will be the extension. Then moving on to the food adulteration. So food adulteration means the laryngism, then the epidemic dropsy, then the endemic ascites, ergotism. Okay, so questions are asked on the toxin and the food adulterant present. Like let me give you an example of the laryngism. So the toxin present is the BOAA, and the adulterant, it is the kesari dal. Then moving on, vector-borne diseases. This is also a must topic. So vector means the vectors of the malaria, then the dengue, then chikungunya. Okay, then typhus, the tick typhus. So question can be asked like the various mosquitoes, like the mosquito Aedes and the Anopheles, they are vectors for which disease, and hard tick, soft tick. So image based questions can also be asked, so you need to look at the images also. Then moving on to the methods of communication. So there are various communication methods like the group discussion, demonstration, and the lecture. So there are various uh, definitions describing these. So demonstration means we will be performing the live thing like the hand washing. Okay. Then lecture means in front one person will be addressing a large number of people, and it will be having a certain series of events. Okay, that one is called as the lecture. Then the group discussion, they will be sitting in on a table and 6 to 12 members will be there and they will be discussing about a topic. Then there is also another type, that is the panel discussion, in which in a panel there will be 4 to 5 members experts sitting and they will be addressing a huge number of community. Okay, so you need to look at all those method of communication. Then moving on, pneumoconiosis. So these are usually the diseases related to the occupational diseases, and questions are asked. These topics can be covered in the pathology and the medicine also. So the examples like the silicosis, then the asbestosis, then bagasosis, the farmer lung. Okay, so all these pneumoconiosis questions can be asked on their pathological finding, or x-rays can be provided, or clinical features can be described, and you need to make the diagnosis. Okay, then moving on, statistical tests and graph. So graph means it will be the histogram, then the bar graph, then the pie chart, the line diagram. So all these things, image based question can be asked, so you need to look at the images also. Like the histogram, it consists like this, like this. Okay, there are no gaps present in between the histogram, and for the bar graph, there are graph like this and components like this, and there is gap present in between them. And the pie chart, it will be like this, describing various things. And line chart, line diagram, it will be like this, the line. Okay, so these were some examples. And the statistical test means the mean, the median, the mode. Okay, so you need to look at the definitions, what is the mean, median, and mode, and how do we calculate it. You need to look at those features also, those things also. Then moving on to the spectrum of diseases. So the spectrum of diseases means it has certain components like the disease. So a person can be diseased, then after that he will be going to the impairment, like loss of any anatomical structure, that is called as the impairment. Then disability, loss of his job or work. Then handicap. So question can be asked describing the features, like a person in an accident, he lost his hand but he is doing his job, so what kind of spectrum of disease it is. So it will be impairment. If he will lose his job, then it will be disability. Then due to accident, he has lost his both the legs and he is not able to perform any social role, then it will be called as the handicap. Then moving on to the nutritional requirements, the things like the dose of the minerals like the iron, then the calcium, if they are deficient, what diseases will be occurring. Then nutrition requirements of the vitamin, and the amino acids, which are the essential, which are the non-essential, and to take in how many dose. Okay, the daily requirement. And about the calories, how much calories will a female need, then calories of the male. And also these calories are classified into the heavy worker, then moderate worker, then sedentary lifestyle. So these calories intake is different for different kind of occupation, so you need to look at those things also. Then moving on to the health economics. So health economic consists of things like the GDP, then the sustainable development goals, the parameters which come under this, the analysis of the health techniques, management of the health techniques like the cost effective analysis, system analysis. Okay, so all these things, these come under the health economics. So this was a brief overview of the things which you must do from the PSM. So PSM also is a vast subject and a scoring subject, so you cannot miss the points from the PSM. And also there's a lot of things other than this present in the PSM, like for example the health planning committees. These all also come under the healthcare system, so you can study these under them. Then the population pyramids, and the age sex pyramid, and the population pyramid. So the pyramids, image based question can be asked, and also the components of it, like pyramid of the developed countries, then the pyramid of the developing countries. Okay, then Then also the pediatric, geriatrics and the obstetrics. So things included in this are the nutrition, malnutrition and the nutrition. Then how do you do the growth assessment of the kids, like by using the charts, WHO growth charts, then using the midterm circumference, then the birth weight, how much it should be, the height, all these things. These are mostly covered in the pediatric, geriatrics and the obstetrics. So these are also asked in integration with the PSM. Thank you so much for watching this video. I hope this video will help you all in your preparation. All the best for your exam. Like the video, share it with your friends. Thank you so much. Bye bye.